an incomplete answer. Unless young boy is asking a young girl to go out for dinner or something. But smile otherwise is an incomplete answer. So it's good to smile, but please, share your opinion and there can only be dumb questions, but there are no dumb answers. So please, because what we are talking about is something very subjective. So in fact, the earlier session, should we be doing this surgery on a neonate or not? So I think we're talking about stuff which is less clinical in that sense, but more to do with life. So please, if there is a question, just raise your hand and answer it or say something. That's my humble request. But and then the other disclaimer I should mention is that I've been in healthcare now for maybe about 30 odd years, but my experience has largely been confined to private sector. And we all agree the private sector is a very different animal. So to that extent, I may have some views which are more reflective of the private sector than the government sector or the public sector, purely because I have had very limited exposure. So these are some of the suggestion, requests, or if I may say disclaimers. But even before I begin, okay, there is this usual joke. What is the difference between God and cardiac surgeon? I think we all know.
God learns from cardiacs.
Or at least God doesn't think he's a cardiac surgeon. Okay. So to that extent, when Amresh said that we are talking about a boot camp of CTVS, you can imagine how crazy or how difficult it may get. And I had 2 or 3 subjects in mind, but I chose this subject because it's just that I happened to give a talk on the same subject and coincidentally to the students and professors of a medical college, and it happened in Imphal. Okay, there's a pretty famous hospital called Sija Hospital. So Sija Hospital in Manipur would be the equivalent of Apollo for that matter. Very nice hospital. Pretty state of the art in the Manipur context. And the fact that I still survived, I'm just saying I'm very much here. It just gave me some courage that maybe I'll be able to pull it through. So that's the context. And that's my name, Ratan Jalal. Now, I read a lot of books about healthcare, and obviously, because I'm not a doctor, I don't need clinical books. I won't even understand, but otherwise, I read a lot of books. So, this was again one book which I read some time back, and the book is actually How Doctors Think. And the gentleman, Dr. Jerome Groopman, he's a professor at Harvard Medical School, so he's very renowned, very knowledgeable. He's written quite a few books, and this is one of his books, How Doctors Think. And he actually talks about different settings for that matter. So in fact, he talks about how doctors tend to make decisions about diagnosis and a whole lot of other things. In fact, he talks about, let's say, in a particular day or in a particular week, if you have had patients of a particular condition coming to you, let's say, very regularly, then how that impacts the next decision for that matter. Whatever it is called, momentum, or there must be a better word for that. He talks about how doctors tend to think in a trauma care setting, and he says that if you're talking about trauma, emergency department for that matter, that is one situation where you don't think and then act. He said you need to think and act at the same time. So he talks a lot about trauma. He talks about radiology for that matter, where you are almost sitting in the dark but still thinking. So there's a lot of nice conversation, a lot of nice arguments. This book called How Doctors Feel, or What Doctors Feel. So one is on thought process, the other is feeling. This again is a beautiful book, and he talks about that a lot of it is subconscious, but even things like gender, okay, or age, or race, or religion, in so many situations impact your decision how to treat a patient or how to diagnose a patient. And obviously a lot of it is very subconscious, but it's a very well researched book. So in fact, I thought, could these be 2 books? But then my view was they'll get very professorial or very theoretical, so let me not attempt that. And that's when I choose this book, Kill as Few Patients as Possible, and is written by this gentleman called Oscar Dr. Oscar London. And that's his brief bio. So that's not his actual name, but Dr. Oscar London is an internist. He's no more, and he practiced in Berkeley, California. And he's written 4 books. This is one of his book, and he also written a lot of humorous essays. I mean, relating to healthcare, which got published in various newspapers or magazines. So there is an actual book, and written by a very senior internist for that matter. And Dr. London actually in the book says that I happen to be the best physician in the world. He just says that. So he said nobody can take away, and obviously he's humorous. He said, I can tell you who's the second best, but don't claim to be the best as long as I am alive. And then he says that I mean, forget the clinical skill and expertise and stuff that kind. But he says that in this book, I've jotted down a few uh, behaviors or few learnings or patterns or observations I made in my own life, which has helped me become what I am as a physician for that matter. So this is very personal, and the book has 57 rules. So this is one of them: kill as few patients as possible, and there are 56 others. So that's the book all about. And what I've done is I picked up at random 10 or 12 of them, and I just thought, let me get your views. Okay, what do these rules mean to you? So this is more of a like I said, loose conversation rather than for me to share some gyan, because I just don't have any. And the other disclaimer is, for God's sake, that when I say kill as few patients as possible, there are certain rules. I just happen to be the messenger. So for God's sake, I'm not the author. Don't look at me. Then how the hell can you know? None of that. So like I said, I just copied, and we're going to have some conversation around this. Is that fine? So I've got 12 of them. This is the first one. And I've just copied the rule, the numbers from the book. So like I said, there are 57 rules. I just copied some of them at random. So rule number 3, it says, if you can't save your patient's life, find someone who can. Any observations or comments? Please. Don't, like I said, smile is for any.
Yeah, I think it talks about the doctor's ego. Rather than that, keep your ego aside and send him to the right person who is the good at doing the job.
Any other observation?
Know your limitation, skills.
Anybody else? Any other comments?
It's very difficult. Like to think that somebody else is actually better at saving the patient's life than you yourselves.
So it sounds very. How often does it happen? And my view, my limited view, honestly, whatever I've seen of healthcare, and I'm talking about this country, and like I said, my experience, frankly, is more in the private sector. And I can tell you that I mean, I was sitting with a self-proclaimed diabetologist. He was a general physician in this place called Thane. Okay, and we got chatting because I was doing some research about healthcare in the city, etc., etc. And it was a horrifying, revelation. I mean, this gentleman would kill a patient, honestly. I'm just saying he will not give up a patient. That's it. I wish me so. I mean, you have a patient who is suffering from diabetes for many years, and he would actually, in front of me, he referred the patient for a blood test to a lab. On the phone, he says that एक patient भेज रहा हूँ और उसका HbA1c इतना है. So he is telling the lab the results. He is telling the lab the results. कि उसका HbA1c इतना है. Simple. So I'm just saying that some of these things, when you get to see for the, and you and you and I have seen enough of what actually happens in real life that, like, I'm just saying, because you need to admit, or you need to confess, or you need to be comfortable with the fact that there is something which you don't have in this particular situation. There has to be a sense of humility. So this gentleman, Dr. London, talks about it. And actually in the book he says, I'll just quote something, very nice line. And he actually says that a clear understanding of how much I don't know about medicine is one of my greatest strengths. He says that, that if you really need to be a good or a great doctor, that somewhere you need to understand your own limitations, or you have to have that humility to accept that there are things which you don't know and somebody else does more than you. So I think that's something which is very, very crucial. He says, keep eye contact with your receptionist. What could he be meaning? Feedback from our patient, because the receptionist who gets to spend a lot of time with the patient, the family, and they would know the pulse. They know what is happening, not happening. Absolutely. What else? Ma'am? If you go to a hospital, please, I understand Apollo is the word of some of the hospital, you'll find that doctors realize or appreciate that the girl who's sitting in the OPD reception area can make or break somebody else's fortune. Huh? Am I right? Yes or no? So there are enough, observation, there are enough theories, there are enough games or strategy being played there. That, and particularly if you're a young doctor, if the person sitting in the OPD reception, okay, if he or she thinks nicely of you, then your life is made. Otherwise, he can pretty much, play games and destroy you for that matter. So I think this gentleman, Dr. London, talks about that why keeping eye contact, or why keeping the receptionist or the people in the OP reception, outpatient reception areas, etc., can actually be of help. Make sense? He says, honor the aged. And somehow I think this is, so we worked with Rainbow Children Hospital. We worked with them, as a consulting firm, and particularly when Dr. Ramesh was, getting into Bangalore. So Bangalore was a new market for them. Rainbow Children was largely Hyderabad. And for 20 years, so everybody knew Rainbow in Hyderabad or around Hyderabad, but in Bangalore it was a very new market. So somewhere the sense I got that, does the likes of Apollo, Fortis, Max, Wokhart, NH, do they treat children? Of course they treat children. They have a very strong pediatric department. But what Dr. Ramesh told me, he says how we are different. He told me as a children's hospital how we are different. And I can never forget the line. He says, in Rainbow Children Hospital, if you have an internist, if you have a cardiologist, if you have a internist, or if you have any doctor, the doctor needs to understand his or her specialty as well as he or she understands children. He says because children are different. They are different in every possible way. He says half the time, or more than half the time, the children can't even describe what is wrong with him or her. Okay. And so he said, he used a very strong word. He told me, he said, Mr. Jalal, that if you're talking about an adult hospital or a large hospital, you don't have too many admissions at night. He says that. At night, things are pretty much, calm, and, there's a certain sense of quietness and less action, less activity, etc., etc. He said it's not the same in Rainbow. He says that if your 3-year-old kid has 103-degree fever at 1 o'clock at night, you don't wait till the morning. For an adult, you're okay. So if your wife has, you yourself has, if your elder sister has, you're comfortable waiting till the morning. So you'll probably give I'm just saying some medicine and wait till the morning. Not for a child. So he said the child is very different. And the word he used was that if you go to a regular hospital, they're used to seeing a child like a small sized adult. So I'm just saying your age is 5 years or 6 years and you're smaller, but otherwise mentally they're not geared. They're not geared. The doctor is not geared. The nurse is not geared. The support staff is not geared. They're not geared to deal with children. Now I am saying the same actually is true for, let's say, elderly folks. I'm just saying if you go to a hospital, if you're talking about a 70, 75-year-old person, I mean, imagine his hearing ability, imagine his vision, imagine the fact that he could be fragile. So I'm just saying, in a typical hospital, do you have an environment which treats elderly people differently? In fact, half the hospital won't even have ramps. If you go to the toilets, washroom area, if you an hour, nothing else. He talked to me about his children, his wife, his investment, his property, his everything in life. And he said that's the best treatment I can give him. So I'm just saying, I think so there is we often tend to rush through things or ignore these realities. But I think when Dr. London says that let's have a huge amount of respect and let's treat them differently, I think this is something which is obviously makes a lot of sense. He said, don't try to feel a breast lump over the phone. Right? So I'm just saying, and that fear, if I may use the word, is a lot more common in today's day and age where you talk about this whole teleconsult is becoming a big deal. So I'm just saying, does teleconsult have a role to play? The answer is absolutely yes. In fact, if teleconsult didn't happen during COVID, you and I can imagine how chaotic the situation may have been. It was chaotic, but it would have been even worse for that matter. So a lot of good can happen through teleconsult. But what Dr. London says, and he actually talks about example. He said, if there is this young girl who calls me and says that I feel like that I have a lump, he said, the only thing I do is to ask her to come to my office, my clinic, okay, immediately, as soon as she can. And when she comes, he just says that I don't go blah, 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 blah. I don't do any of that. So I said that, yes, there is a lump. And the first thing I would advise is, let's go through a biopsy. And then I don't give a theory that in 33% of the cases, it is benign and this and that. He said, whatever reality is, okay, we'll find it out. And if at all it's not benign, okay, we'll find a way to treat it and life can go on normally. Don't worry about it, etc., etc. But he talks about a few of these examples, and he says there's a very clear rule number 26 by him. We say don't try to feel a breast lump over the phone, and it's not just about a breast lump. I mean, you could have a cardiac issue, you could have a orthopedic issue, but there could be a whole lot of issues. And the guy says that you should have the maturity to very clearly advise the patient that for this situation, let's not limit it to teleconsult. It's better that you come to me and I'm able to examine you physically or otherwise and take the proper course of action. So he's very clear on that. He said, praise nurses and your patient will live forever or die happy. The irony of the situation is that when you have the World Nursing Day or some other day or Florence Nightingale Day or this day or that day, okay, on a platform, on a podium, all of us will keep on saying the nurses are the backbone of healthcare and without nurses and this and that, all that will happen. But in reality, I mean, I think all of us know how badly, okay, nurses are treated, at least in the Indian context. Okay, whether you talk about, let's say in the government sector, probably the compensation is not that bad, but whether you talk about the quality of nursing education, whether you talk about compensation, whether you talk about work environment, or whether you talk about the given inequality, if I may use the word, between physician and nurses, it's proverbial. It's proverbial, that that they just don't get the kind of respect which I think they deserve. Okay, and so I think, recognition, respect. In fact, I was talking to some senior physicians in the country, Dr. Nandakumar Jairam, Dr. Vita, and some others, and they said, which is very interesting. She said, Mr. Jalal, every once in a while you will find in newspaper some hospital talking about some great clinical outcome. Right? We had this patient from Pakistan or this place or that place, 73-year-old or 3-year-old, 3-day-old, this happened and that happened. And you will find 8 surgeons, 8 physicians. But have you ever seen a nurse? Ever in the picture? Do you ever see a nurse? So I'm just saying, whether you talk about a very tricky organ transplant, whether a tricky surgery for that matter, I think the world view is that it's always the physician and nurses actually don't play any role at all. But Dr. London is saying that nursing is so very important, and he says praise nurses and your patient will live forever. And I think somewhere the whole idea is that as physicians, I think there is a need for us to look at nurses or nursing more as a partner than as a insignificant subordinate player for that matter. So that's a very strong view he has, and I think I'm quite passionate about nursing, so I completely agree with what he says. He said, let no one leave your office without a handshake, a blood count, and a smile. Okay, and I'm just saying, I think the last one is very crucial. If you talk to patients, okay, that what makes a doctor a really good doctor? Why do they really like or love a few doctors or some doctor and they don't care much about others? What do you think would be the common answer? Why do people like a few doctors or some doctors? What would be the most common answer?
They don't listen to what we say.
He said they don't. So I'm just saying, you like a particular doctor, let's say, who listens to you or spends some time with you. Am I? So in fact, if you talk to anyone, whether you're talking about rich or poor or literate, illiterate or literate, etc., in Hindi, the most common expression is that उससे बात करके आधी तबीयत ठीक हो जाती है. Am I right? That you talk to the doctor and you feel half cured. So I think a lot of it has to do with patience. A lot of it has to do with, I'm just saying, doctor's ability to listen. In fact, there is research which says that a doctor interrupts a patient, 14 seconds after he or she started speaking. 14. For specialists, it's even less. So the fact of the matter also is that a doctor rarely lets the patient talk. That's the fact of the matter. I'm just saying that, and it's not government hospital, private hospital, or US or India. It's a universal phenomenon. So what Dr. London is saying, in fact, I still remember that when we did the birthplace, we always said, so I'm just saying, when the patient is leaving the doctor's office or the clinic, or for that matter, in fact, at the door it was written that don't leave if you have a question on your mind. So in fact, I remember, there have been times when I've been with Dr. Devi Shetty, and as a routine, when he's consulting a patient, poor patient or mother or father or whatever, when they get up, the only thing he will always say, do you have any more question in your mind? And he will say it in broken Bengali or Hindi or whatever the language is. But if you have any, and he always says that whatever question you have is a valid question. So don't think whether to ask or not to ask. So somewhere what I think Dr. London is trying to say, that please ensure that a patient does not leave your place, with some worries or some concerns in their mind. So that's what he's saying. And the blood count, you can imagine, he actually talks about, that if there is a diagnosis which you think you're not certain about, then you might as well do that. So that, oh my God. Right? So that's like, in fact, it's very common that, when something of this kind happens, you feel like cutting a cake. And at least in, I mean, I don't know about the public sector institution or hospital, etc., but in private sector, I'm just saying that whether you talk about a young doctor, whether you talk about HOD, I think they're more worried about others than about themselves. They would hate to go and leave, hate to go and leave. Like if you go and leave, and if some big patient, something comes to the other guy and they start liking him, then I'm dead. So this whole thing about insecurity caused by others is such a big deal. Such a big deal. I still remember when Dr. Manmohan Singh got operated by Ramakant Panda, how many doctors were waiting for him to screw up? Are you with me? How many doctors? Like Apollo, everybody said, boss, hum to smart hai. Are you with me? We are not doing it. You know how smart we are. Because it's just going to get messed up. So there were major theories around that, I mean, that, we are wise, we are smart, that thank God we are not doing it. That's the end of Dr. Panda. Similarly, Vajpayee and others. So if you talk about a high profile case, then the world is waiting for you to just mess it up. So the guy says that don't take too much joy in the mistake of other doctors. And he says that, for all you know, it could be your turn some other day. He says, in your appointment schedule, join the misery of others. So all of that, I mean, that sounds very old school. I mean, not don't relate to the today's world, but that's what he's saying. Ask your patient what is shaking down at work and what is cooking at home. Now, why I'm saying is that and my view again, we did a lot of work in orthopedics for that matter, orthopedic. And you talk about some of the senior most surgeons in the city or otherwise, it's so surprising that you do TKR or you do hip replacement surgery, etc., etc., and you have zero idea about the person's living condition, lifestyle, living condition. I mean, where do they sleep? What kind of a bed they have? What kind of washroom facility they use? Okay, how do they cook? Not cook? What kind of kitchen? Raised platform? Do they sit? Not sit? Religious prayers. So in fact, I think if you, which is why I think there's another line which people say that don't treat the disease, treat the person. Or there's a very nice line where the person says, I'm not my disease. Okay, I'm more than what my disease is all about. So I think what Dr. London is trying to say that it's so very important, and we might think that we just don't have the time, but what he's trying to say that is so very important for us to think of a patient as a person. And that's why he's saying that, just find out what is happening at work and what is cooking at home. So in the sense, get a sense of the professional life, get a sense of the personal life. If you really want to care, or if you really want to treat the patient the way he or she would like to be treated. So I think that's all I had to say, and I hope it has triggered.
Thank you, sir, so much for that interesting talk. Now I request Dr. Amre, sir, to present the memento to Mr. Ratan Jalal.
But as you said, you might have told how not to fill up in always not so